Hi, let's talk about the lacrimal system. In this video, we'll discuss the components of the lacrimal system, detailing the pathway of tears from the lacrimal gland to the nasal cavity. We'll also distinguish between the somatic and autonomic innervation of the lacrimal gland. So the lacrimal system consists of the lacrimal gland and the entirety of the pathway of tear conduction to the nasal cavity. So this process begins in the superolateral portion of the orbit. So the lacrimal gland is found adjacent to the lacrimal fossa of the frontal bone. It secretes tears or lacrimal fluid into the conjunctival sac. That's the space between palpebral and bulbar conjunctiva. And those tears are conducted toward the medial canthus, or angle, of the eye. Now, along the palpebrae, we have tarsal glands, also known as meibomian glands, which secrete meibum, which is an oily substance. This helps prevent the tears from spilling out by creating a hydrophobic barrier. And this also aids in the prevention of evaporation of the tears. So those tears have nowhere to go but that medial canthus. And this area here of the medial canthus where the tears accumulate is known as the lacrimal lake. So tears accumulate in that area, and they are absorbed through tiny little pores or puncta in both the superior and the inferior eyelids, and then conducted via canaliculi out to the lacrimal sac. This lacrimal sac is deep to the lacrimal part of orbicularis oculi. I think of it like a little squeeze ball. So when the muscle contracts, it squeezes that, and when the muscle relaxes, it creates a vacuum, sucking the tears into the lacrimal sac. This is considered a dilation of the proximate part of the nasolacrimal duct, which is a pathway down into the inferior nasal meatus. So that's the space that's underneath this inferior nasal concha here. So your tears move from the lacrimal gland across the conjunctival sac into the lacrimal lake, into the lacrimal sac, through the nasolacrimal duct, and into the inferior nasal meatus of the nasal cavity. It's important that we differentiate between somatic versus autonomic innervation of the lacrimal gland. The lacrimal gland somatic information is complements of the lacrimal nerve. The lacrimal nerve is a small branch of V1, which is the ophthalmic division of the trigeminal nerve. So in this illustration, we can see the trigeminal nerve here. And there is V1, which is the ophthalmic division, V2, the maxillary, and V3, the mandibular division. So V1 is going to be a major player in terms of the orbit and eye. And here, outlined in brown, we can see that lacrimal nerve heading out to somatically and afferently innervate the lacrimal gland and surrounding areas. So not only will it conduct somatic afferent fibers back from the lacrimal gland, but also from the conjunctiva and the surrounding skin area. The autonomic innervation of the gland is from a completely separate source. And to understand that, let's turn our attention to this illustration on the bottom. Here we're looking at a lateral view of the skull. And right here, going through a rather large osseous canal, is the facial nerve, cranial nerve 7. The facial nerve is what supplies the preganglionic parasympathetic fibers. You can see them heading out here. This is along a nerve called the greater petrosal. And it's met with a nerve called the deep petrosal, which is conducting sympathetic fibers from this superior cervical ganglion up along the internal carotid artery. So sympathetic fibers from the internal carotid plexus from that superior cervical ganglion meet preganglionic parasympathetic fibers to form a nerve. This is called the nerve of the pterygoid canal. This heads out towards a ganglion there. So this is a peripheral parasympathetic ganglion known as the pterygopalatine ganglion. An older name for it is sphenopalatine. And it's found in the pterygopalatine fossa, that area that's contiguous with the orbit by means of the inferior orbital fissure. So the preganglionic parasympathetic fibers from the facial nerve will synapse there, and they hitchhike out along V2 branches. So here we can see going out to the orbit. If we turn our attention to this illustration up here, we can see there's V1, there's V2. The V2 fibers have grabbed those postganglionic parasympathetic fibers and deliver them out to the lacrimal gland. So with parasympathetic stimulation, we have the enhancement of lacrimation. So the rest and digest creates tears. Sympathetic stimulation, again, complements of this superior cervical ganglion of the sympathetic chain, is going to inhibit lacrimation, and it will also lead to local vasoconstriction. So we have discussed the lacrimal system, the pathway of tears from the lacrimal gland to the nasal cavity, and we've also discussed somatic innervation via the lacrimal nerve and autonomic innervation via the facial nerve, the pterygopalatine ganglion, as well as V2, hitchhiking, and the sympathetic innervation of this gland. This is your summary slide. Thank you very much for your time.